Hi, my name is Priyanka Bakri, and my presentation focuses on the United States response to the 2009 H1N1 outbreak versus the 2020 coronavirus global pandemic, a comparative analysis of the effects on the non-white populations in the United States and their access to healthcare. This is a quick overview of what I will be going over throughout this presentation. I will begin with a general summary, followed with some background information, then the Obama administration's response to the H1N1 pandemic, followed by the Trump administration's response to the COVID-19 pandemic, and some key findings and conclusions, followed by a bibliography. To begin, here is a quick overview. In the United States, the novel coronavirus that caused the 2020 COVID-19 global pandemic has led to over 500,000 deaths, according to the Centers for Disease Control. This toll stands at a stark contrast to the 2009 swine flu outbreak, which was caused by the H1N1 flu virus, which only led to 12,000 deaths. However, amongst both these pandemics, there was a key commonality, which was the high impact on non-white populations. This study will assess if this high impact of COVID-19 on non-white populations is associated with the social determinants of health or government mishandling. Specifically, I will use data from interviews with primary care physicians working with non-white populations in determining if access to proper protective equipment further exacerbated high transmission rates amongst geographic locations with large non-white populations. Importantly, I will use the H1N1 pandemic as handled by the Obama administration, which provided a noteworthy example of a swift federal response to disease outbreak as a case study when analyzing the steps which were taken by the Trump administration. The results will be utilized to determine how the federal government can make healthcare access, such as access to proper protective equipment, more equitable to deter future rates of high disease incidence amongst non-white populations. To begin, here is some key background information that might be necessary in understanding more about this thesis. Specifically, a pandemic is an infectious disease outbreak that affects several countries by a multitude of criteria, which includes geographic movement, disease movement, explosiveness, minimal population immunity, novelty, infectiousness, contagiousness, and severity. In the past decade, the United States has experienced two major global pandemics, the first one being the H1N1 pandemic, which occurred in 2009, and then the COVID-19 pandemic, which began end of 2019, beginning of 2020. The federal government vastly differed in their response. In 2009, the Obama administration provided a swift federal response, which was unified and resulted by working closely with the CDC and the World Health Organization, also known as WHO. In 2020, the Trump administration exhibited a slow federal response, which was unprepared, and they worked independently, specifically with the interests of their stakeholders in mind, which was out of the norm as seen by previous administrations such as the Obama administration. Additionally, the social determinants of health, which is something this thesis focuses heavily on, are measures which are described as conditions where people work, live, learn, and they affect a variety of different aspects in life. The social determinants of health became important once this framework was taken on by the World Health Organization in 2008 and then adapted by the Obama administration in utilizing it to understand the disparities which exist amongst minority populations in the United States, which include but are not limited to things such as access to healthcare. The figure below from the article, The Disproportionate Impact of COVID-19 on Minority Populations by Don Bambino Gino Tai and his colleagues shows the interplay of COVID-19 as further exacerbating the health disparities in non-white populations. As seen in this figure, the social determinants of health are the common factor which combine host issues such as chronic diseases, malnutrition, poverty, lack of access to health care, and insurance with environmental issues. The intersection of both of these led to a much higher effect on non-white populations as working as frontline workers, living in crowded areas, and taking public transportation works in conjunction with limited resources and access to proper protective equipment. A similar effect was seen in the H1N1 pandemic, which also had the highest impact on non-white community populations. In a study performed by Quinn and his colleagues, it was found that the risk of exposure to H1N1 was significantly increased depending on ethnicity. The most affected group was Spanish-speaking Hispanics for exposure, followed by African Americans. The figure in the previous slide speaks to the high impact social determinants of health combined with the response of the government can have on non-white populations and did have during the COVID-19 pandemic in the United States. This was a stark contrast to how the Obama administration responded to H1N1. So in a study performed by Veboud and his colleagues, it was determined that there were about 7,500 to 44,000 deaths caused by the H1N1 influenza, with non-white populations experiencing the highest impact. As a result, the Department of Homeland Security, Centers for Disease Control, and World Health Organization worked closely together to declare a pandemic and transparently with the United States government. This led to the government releasing stocks of proper protective equipment from the national stockpile, as well as antiviral drugs and other necessary supplies. Additionally, the Obama administration requested a $9 billion emergency relief fund in the first 2 months of declaring a pandemic with Congress. And the second half of the efforts focused on creating a vaccine immediately in a three-phase pre-planned development, starting with prototype vaccines, then conducting clinical trials, and following by administering the vaccine widely and making it publicly available. The Obama administration's intervention focused on preventative care with emphasis on FDA emergency use authorizations, travel notices, and disease surveillance. There was transparent communication with government and the general public. There was no shortage of proper protective equipment across the United States, and the overall conclusion was that the disproportionate impact on non-white populations was a result of the social determinants of health and not of a mishandling by the government. On the other end of the spectrum, the Trump administration had a completely different response to the COVID-19 pandemic in 2020. They had a delayed federal response due to the fact that in 2018, the National Security Advisor at the time, John Bolton, urged a disbandment of the pandemic response team. Additionally, the White House deliberately ignored early information from the World Health Organization in 2019 on the severity of COVID-19. They decided to act independently due to major corporate influences focused on economic management and keeping the economy open for as long as possible. There was a feeble attempt to establish surveillance, increase testing, and transparency. However, none of these notable goals were met, which further aggravated the disaster on the ground. The administration worked in pushing forward an unrealistic timeline on vaccine distribution, leading to public mistrust. Also, they utilized social media to influence citizens to misplace blame on the science community, leading to a lot of confusion. Overall, non-white populations were severely affected as compared to their white counterparts. This was a result of the fact that while the economy was open, many of essential businesses, such as grocery stores, were manned by frontline workers, which were part of non-white populations. Additionally, the social determinants of health and limited access to health care, including proper protective equipment, was a key issue when pertaining to COVID-19 and the Trump administration. They had a severe shortage of proper protective equipment for people working during the peak of the pandemic, leading to an increased disparity. Over winter break, I had the opportunity to interview 4 family health physicians from the H1N1 Family Health Center located in Worcester, Massachusetts. When speaking with them, all of them agreed that they saw a higher COVID-19 infection rate amongst their non-white patients as compared to their white patients. However, all of them did see the same trend during the H1N1 pandemic. There was a key difference, though. During the H1N1 pandemic, it was contained earlier on, so there was no shortage of PPE, and it was not as widely mandated. However, PPE was not as accessible to non-white patients in the beginning of the COVID-19 pandemic based on their experience. All of them believed that the Trump administration did mishandle the COVID-19 pandemic, which is a stark contrast to their belief of the Obama administration not mishandling the H1N1 pandemic. Here are some key updates and conclusions. Based on research thus far, the disproportionate impact of COVID-19 on non-white populations is a result of the federal government mishandling the pandemic and pre-existing healthcare issues as seen through the social determinants of health. However, my remaining research will focus on diving further into understanding how the combination of the federal response and the social determinants of health led to creating such a high impact on non-white populations in the United States, specifically utilizing the pandemic playbook and discussing potential solutions to the inequitable healthcare access in the United States and how to make it more just to decrease the disparity across varying ethnicities. Here is my preferred contact information if you would like to see a final manuscript. The remaining slides are my bibliography and the sources which I used to gather this information.